Let's bring in right now Governor Cuomo. Governor, thank you so much for being with us. You've certainly been on the forefront of governors across America, responsible, pushing forward, asking for help from the federal government, but also understanding that you're going to have to take matters into your own hand, because it's sort of like Katrina. I was on the ground in Katrina for the first 2 weeks before the federal government did anything. Anybody waiting for the government to respond to Katrina kept waiting. It seems like we're at the same place here, 15 years later, except this time it's not a hurricane, it's a pandemic.
No, you're 100% right, Joe. I said that this is the Hurricane Katrina version of a public health situation, and we are taking matters into our own hand, frankly. We are doing drive-throughs. We didn't wait for the federal government, and we're doing everything we can do. But you and I were both in the federal government. We understand the capacity. There has been no country that has handled this, Joe, without a national response. And we've been behind on it from day one. I'm not giving up. There are things we need the federal government to do. You look at today, the news, all these patchwork acts by these different states. It makes no sense for me to take an action. I close bars and then people drive to New Jersey or Connecticut, my neighboring states. You need a federalized response, especially on the looming crisis. And the looming crisis is that curve that everybody talks about is not a curve. It is a wave. And the wave is going to break on the hospital system. There is no projection that says our hospital system can handle this. We need the Army Corps of Engineers in here now, retrofitting old buildings, dormitories, et cetera, for more hospital capacity. That's what China did. That's what South Korea did. That's what Italy didn't do. And I have one of the largest state governments in the nation, but I can't build hospital beds in 3 weeks. No. I need the Army Corps of Engineers.
Well, and also, Governor, don't you need these people separated from the rest of the hospital population? You have an op-ed out this morning, which is a call to President Trump to mobilize the military to help fight coronavirus. I mean, military hospitals being set up around the country would do a lot to stop the clusters inside the medical community and among the people who are on the front lines of helping the sick.
That is exactly right. And look, they say life is options. We don't have any options. We know the healthcare system will become overwhelmed. That's how people die. I only have 3,000 intensive care unit beds in the state of New York. About 80% are already occupied. So I only have about 600 beds available. I already have 60 people in those beds. This is a disaster waiting to happen. We know it. The only alternative is to develop more beds, retrofit. You're not going to build anything new. Get some of the people out of the hospitals into those new medical facilities and do the best we can. It's still not going to be good. But just to be wasting day after day after day, this is nonsensical, and it cannot happen without federal resources, period.
Now, you know, you talked about how we were both in the federal government before. A guy who was Speaker of the House that I had, I think it's safe to say, an up-and-down relationship with, was Newt Gingrich. And, of course, I haven't agreed with much of anything he said over the past 3 years since Donald Trump's been elected president of the United States. But it's interesting that I'm finding Newt Gingrich is writing an op-ed saying, I'm in Italy, the coronavirus is deadly serious, and America better wake up. I'm finding more and more Republicans who have blindly defended the president over the past 3 years are now waking up to the reality that we can't bluff, we can't BS our way out of this pandemic. Are you finding that as well in New York? Are you finding that Republicans are more willing to work with you, despite the fact that the president is still sending reckless mixed signals?
Yeah, I think what's happening, Joe, is, first of all, people are frightened. They're truly frightened. They're frightened for themselves. They're frightened for their families. And that overrides partisan loyalty, right? It's about them now. It's not about loyalty to their political party. Secondly, it's unavoidable on the facts. People know what's coming. You look at that projection, Dr. Fauci puts up that curve every day. You know that curve is going to crash, and we can't handle it. And also, I think the president is trying to show leadership, and he's trying to show leadership by calming people. And that is a responsibility of leadership. But you don't calm people unless you tell them the truth. You're not going to deceive people. You're not going to say, it's all going to be fine, take 2 aspirin and call me in the morning. So they know it's not working, and it's actually making things worse. And when the federal government then is not doing its role, and you have these broadcasts of every city, every state doing all these different things, people see pandemonium. And it is frightening. You put pandemonium on top of a pandemic, it is a bad situation.
Yeah. Caddy K is with us in Washington, has a question for you, Caddy.
Governor, you've seen the pictures from Europe of countries like Italy and Spain on near total lockdown. Do you think we're going to get to that stage here in the United States? Do you think you're going to get to that stage in New York City? In Rome at the moment, you cannot go out in the streets unless you have a special pass that lets you go out in the streets. Police will stop you and check your paperwork. Is that where a state like New York is heading?
Yeah, I hope not, and I don't believe so. And I don't even believe you could do that in this society. But I'm going to be announcing more actions today. I closed the schools yesterday, making sure there's child care for healthcare workers, because, again, this all comes back to hospital capacity. Some of these states have closed schools that made no capacity for child care, and now you see healthcare workers and nurses not showing up. So closing the schools, closing bars, closing restaurants, closing mass gatherings. We'll be doing more of that, because right now the numbers are continuing to spike. So you have to ratchet down on the density control if you're going to get those numbers anywhere near where you can manage them in the hospital system. But for me, my priority is turning to the hospital system, because that's where we're going to have a major crisis, and it's weeks away.
Governor Andrew Cuomo, thank you very much. Appreciate it. Appreciate your leadership. Coming up, the mayor of New York City, Bill de Blasio, is standing by. He joins us straight ahead. Morning Joe is back in 2 minutes. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.